Hello, everybody. Good afternoon, and welcome to our weekly media briefing, COVID-19, here in Montgomery County, Maryland, with County Executive Marc Elrich, Dr. Travis Gales, who is our health officer, Dr. Earl Stoddard, who is the director of the Office of Emergency Management and Homeland Security. And today we're also joined by Dr. Raymond Crowell, who is the director of the Department of Health and Human Services here in Montgomery County. He will bring us a short presentation. I'm Lorna Vergelli, Hispanic Public Information Officer. Will be moderating this gathering. And with that, let's get to you, Mr. County Executive. Reporters, I think you already have permission to record, and we'll use the chat to communicate. Mr. Elrich.
So welcome everybody. And this is our first press conference with a whole lot of snow on the ground still. So that makes it different than any of the other press conferences. I want to just talk to you about the state of vaccination in the county right now. There's been a lot of discussion about equity and ensuring that we make every effort to ensure that all communities have equal access to the vaccine. That's why I've asked Dr. Raymond Crowell to join us today, because in his part of the briefing, he's going to be talking about equity access. It is absolutely essential that we are proactive about this. We know there are communities, particularly communities of color, whose historic relationships with the medical profession have not always led to them having trust in the medical profession. We have to overcome resistance to vaccines. And we have communities who do not have the either connections, the connection to the news media, or frankly, even the technology to take advantage of some of the ways that people sign up. And so they're at a real disadvantage in a first come, first serve system. If that's how we were doing things, we would be severely disadvantaging these communities. So we're taking steps to make sure that the people we vaccinate every week look like the community that we are every week. And again, Dr. Crowell will talk more about that. It is important that the state and the other organizations that are distributing vaccines focus on this issue. There is not an equity requirement that anybody is following. The state has not required the providers to develop equity plans. So we're doing this on our own, but we feel pretty strongly that this ought to be part of everybody's implementation plan, is to assure that the vaccines get out into community equity. Yesterday, I sent over to the council a new executive order that lifts the ban on indoor dining. Under the new order, it'll go back to 25% capacity, back to alcohol sales stopping at 10 o'clock. And we're also asking people to limit their stays in a restaurant to 1 hour. And I want to say, there are two reasons for this. And one is, we know that the longer you stay in a closed room, the greater your exposure to coronavirus can be. There is absolutely no certainty when you go into a restaurant that nobody there or that everybody there does not have COVID. There's zero certainty of that. And the longer you stay exposed to COVID and the longer you stay exposed, the greater possibility of building up a load of COVID virus that could impact your health and produce an infection. So from a health perspective, this is one thing we're changing to try to limit people's exposure. But I'll also say this idea actually came to me from a restaurant owner who, while talking about the health benefits, mentioned that because restaurants are actually the only place we're all allowed to go, or we were all allowed to go, where you could actually sit down and be with other people. Pretty much every place else is gone. And restaurant owners, at least this owner, was finding that people were coming in and sitting for very, very long times at the table. And, you only can eat one meal at a time. So you're not sitting there eating a meal every hour and maybe drinking a lot of coffee like I might be prone to do. But that's, not fair to the owner who has to turn over these seats. Now more than ever, when there are limits on capacity, having people sit in a booth for an hour or two or three really is an impediment on the owner's ability to maximize the use of their facility. And so the suggestion was to limit things to an hour so there would be turnover. So I think it should be helpful to restaurants to ensure that their seats are taken up by new customers every hour, and should help us in trying to control the spread of coronavirus by limiting the number of hours that you can sit and be exposed to it. Let me be clear about this, and we've said this before. Everything we do that opens something up increases the risk of spread. You can't open things and not increase the risk of spread. We have been monitoring our numbers, and we've seen a downward trend over the last 14 days. Our numbers are now very similar, if not a little bit below where we were when we stopped indoor dining. Our cases have dropped to 147. That's today's report. Test positivity rate is dropped to 5.22, and the cases per 100,000 are down to 23.85. It was only a little while ago when we were hitting 40 in cases of per 100,000, and total number of cases were hitting close to 500. So these are significant improvements, and we're hoping that with these trends maintain themselves, and that the measures we're putting in to make indoor dining, we think, a little bit safer, allow us to continue to see a downward trend. I think that the numbers last week, just as a reference point, we had on the same briefing last week, we had 359 cases, positivity of 5.9, and we had 33.7 cases per 100,000. So that's the progress we've made. And I just want to remind people, we didn't get there by accident. There are reasons why we have some of the lowest rates in these categories in the state, particularly among the large counties. And we have been more protective for a long time. We're going to continue to be more protective, even in doing what we're doing now. It's more protective than some of the counties are doing, but until we see more improvement, we're going to stay here. And if we do get more improvement, then we will, open things up more. But how much we open depends on how widespread the virus is in the community and what we're seeing in terms of cases. We understand that these have been tough times on our businesses. We've provided assistance to them, and I know it's not enough. And, we are lobbying the federal delegation as much as we can to have them bring meaningful relief to the business sector. They are truly the collateral damage in all this. And it's one of the unfortunate things about making decisions that maximize public health, is those same decisions can be detrimental to the operation of businesses. We know that. We have chosen that we are prioritizing public health. I am perfectly comfortable saying that I've prioritized public health because I think, be honest about this, money can be replaced, businesses can be restarted, loved ones cannot be reclaimed. No amount of aid or support from the federal government will ever make up for somebody that you've lost. And the damage to families can be long-term and painful. And so I feel that prioritizing the public health is what we ought to be doing, and we're going to continue to do that. Throughout the last month or so, Montgomery County Health Department has done a good job of getting shots into people's arms. We're pretty much able to vaccinate everybody that we get vaccines for. Unfortunately, the amount of doses coming to the county has declined as the state continues to try to find additional private providers. And so while the total doses, they actually did go down this week, but while total doses had been somewhat stable in the county, they've shifted from relying on the county health clinics for this and shifting a greater portion of the supply to other providers. I will point out that of all the providers, only the county right now is looking at this in terms of racial equity justice and in terms of focusing on the priorities of finishing the 1A group, and which are our health workers, and finishing the seniors, which are the folks 75 and older. We're the only group that is following the priorities that have been set out. The other entities that give vaccines are allowed to set their own rules as long as they're within all of the groups that the governor has now made eligible. I wish that everybody who is eligible could get vaccines, but essentially right now we have more than 200,000 people competing for a weekly total of somewhere between 12 and 15,000 doses. It leads to chaos. It leads to, the kind of frustration where people call in the morning. I've had people tell me they get on the phone at 9 o'clock trying to get into a clinic and schedule a vaccine, and either they're all gone by the time they get taken, or they're in the middle of an application for a vaccine, and then it alerts them that the vaccine is no longer available because somebody else got it. You've got 200,000 people trying to get 15,000 doses. We really need, and I've asked the governor to consider at least making clear who we should prioritize. My fear is, and I know it's shared by other health officials, that the more this is up for anybody in these groups, that the groups that the state prioritized first are healthcare workers and the seniors over 75 with the highest death rates, that the vaccines that we expected to go to them are going to other groups out of line with the priorities. So it would be good if we focused our prioritization on people in the order in which it was originally laid out. There are 2 million people in Maryland, with 1/3 of Maryland's population, who are eligible for doses just in phase 1, to put it in a statewide perspective. We've been vaccinating people 75 and older who've pre-registered. So far, between the hospitals, pharmacies, and county-run vaccine clinics, nearly 20,000 people over 75 have been vaccinated, and nearly 9,000 people between 65 and 74 have been vaccinated. I think I was told today that on our pre-registration site, we've pre-registered about 85,000 people over 75, just to put that in perspective. Over 150,000 have registered on our site, and residents who do not have access to the website and need help pre-registering are advised to call the Vaccine Pre-Registration Assistance line. And that line is open from 8 a.m. to 6 p.m. And that phone number is 240-777-2982. And this is to help those people who either can't navigate the system on their own, don't have the computer technology to do the system. So this is an opportunity to call in, and we will take care of assisting you getting scheduled. So how many doses did the county receive this week? In total, we got 12,275 doses, including all providers. Our health department got 5,500 doses. Suburban, which is part of the Hopkins network, got 2,400 doses. Adventist got about 2,200 doses. Holy Cross got about 1,000 doses. Kaiser Permanente got about 1,100 doses. Mobile Med got 100 doses for that total of 12,275. Safeway and Rite Aid have been added to the list of pharmacies that are also providing vaccinations. So we're getting doses into the arms of people as quickly as we can. Supply continues to be constrained. The federal government has not yet increased supply. I did not expect the federal government to be able to increase supply quickly, because once everybody found out that there were no supplies being held in reserve, that means we're completely dependent on the vaccine providers ramping up production, and also new companies getting approved and being able to bring vaccines to the market. So we know that these things will happen. We know the companies have committed to increasing production, but it is going to take a while before we start seeing their doses. And as we increase the doses, we will be able to get them out. The county right now could handle 20,000 to 25,000 doses a week. So we are not limited by our capacity at this point. And we have enough additional partners that it should be a long time before we reach capacity limits. We are now pre-registering people 65 and older for doses. When your turn comes, when vaccine becomes available, we will notify you. But again, I'll say you can go through the state site, and it's possible that you can get an appointment there. But for pre-registration, we're pre-registering for people for the doses that are coming to the county. And like I said, that's limited to about 5,500 people a week. Again, hopefully Congress sends more money our way. That would be an enormous help. I cannot emphasize how important it is that people not share links. If you get a link telling you you can schedule and you use that link, that is great. Do not send it to your friends and neighbors, because they will attempt to use that link. And if they get a vaccine scheduled, they will be taking a vaccine away from somebody who was actually eligible right now. So we're asking people to hold back. The state has said they're going to fix this and make it so every link has a unique identifier. And once that link is used, other people won't be able to use that link. So if you get a link and you think you're going to just send it to everybody else, one of your friends may register before you do. So you could even be hurting yourself. So if you get the link, use the link, but do not share the link. If you're between 65 and 74, you can get vaccine at Kaiser Permanente, Giant Pharmacy, Adventist Healthcare, and Suburban Hospital. I know we're in a very tough time, and this is not fun. It never was fun. It has continued to be really stressful for a lot of people. I feel for folks out there who are struggling, whether it's to pay rent on your apartment, pay your mortgage, or pay your bills in a business. This has made life difficult for a lot of people. And I'm seriously hoping that the federal government puts together an aid package that addresses the needs that people out here really have. I feel, this country rebuilt Europe after World War II. We looked at what had happened and we felt an obligation to rebuild that continent so those folks could move forward. I feel pretty strongly that the federal government has an obligation to help rebuild this country and to help undo the damage that was done to people who, through no fault of their own, either got sick, lost jobs, or lost businesses. We've got a lot of folks who didn't do anything other than go through life the way they were normally going through life and then had their opportunities taken away by COVID. So I'm a big believer the federal government needs to act, and hopefully we will see the kind of program that we need. I guess lastly, if you know anybody in 65 or older that does not have a computer, please help them register. We know there are a lot of folks out there in the community who have that limitation. If you know somebody who's not computer savvy enough to navigate this, please help them, and particularly in our Black and Latino communities where these disparities are the greatest. And having said all that, I'm going to pass this on to Dr. Gales.
Good afternoon, everyone, and happy Wednesday. I'll make my remarks brief. I know Dr. Crowell will be talking about our equity components, which I think is extremely important and frames the conversation of the ongoing pandemic efforts, in particular as it relates to vaccine distribution. I would like to highlight a couple of points that the county executive mentioned. The first one is we are seeing positive movement in terms of our case numbers and community transmission levels in a downward trend. We have been monitoring those closely, and we have seen some test positivity numbers drop. I think one day this week, the average did drop below 5 to 4.9%, as well as our case rate has dropped significantly and improved over the last week. Now, certainly we don't look at that as a bellwether to say we are out of the woods and we don't have a long ways yet to go, but it is promising indications that we're moving back in the direction that we were at earlier in the fall before we saw the winter surge of cases. Now, with that said, we also are continuing to monitor hospital numbers, which again appear to have stepped back from the ledge, if you will, and stabilized. But certainly we will keep our eyes out on that. But to pivot to the other side is, yes, we are optimistic given the way the numbers are trending right now and looking not only here, but across the region and the state. But we do have this other concept of variant strains that are present within our community. As some of you know, there have been two predominant variant strains that have been present or talked about in the United States, including the UK version as well as the South African version. We have had reports of both variants within the state, and we did receive some information earlier this week of two preliminary positive cases that are awaiting further confirmation from genetic sequencing with our public health lab. The information we have right now is significantly limited, but we do think it is tied to travel and not examples of community transmission. When we have further information, we will make that available as necessary and appropriate. But right now, that's all we have to report. The second thing, as the county executive mentioned, is we continue to have great distribution of the vaccines that we've received. Not only are we prioritizing and getting the doses that we have out, we're continuing to provide guidance and create partnerships with our health systems as well as other entities within the county who are receiving doses, including our retail pharmacies. We are doing everything we can to ensure that there are strategies put into place to emphasize equity and fair access across the county. Again, Dr. Kroll will talk a little bit more about that in a second. But we do want folks at home to understand that those are the principles that are guiding our efforts and guiding the input that we're providing to different entities. Now, this week, as you know, last week, Johns Hopkins through Suburban Hospital did begin providing doses to education staff, teacher staff through our public schools. Dr. Stoddard and I had a town hall with non-public school leadership on Friday to discuss a host of issues. We have connected them with individuals from that entity, as well as continuing to explore other opportunities to increase access to the vaccine so that all those populations, including teachers and other essential employees, as well as individuals over the age of 65, will have access points while we as a county apparatus continue to prioritize and get doses out to our older seniors. In the interest of time, I will stop there, turn the floor over to Dr. Kroll, but as always, happy to answer any questions you all may have. Thank you.
So good afternoon, everyone. Happy to be with you today. Want to have a chance to talk a little bit about, outline the broad strokes of the county's equity framework for vaccination and how we will move forward throughout the rest of this pandemic. We've seen since the beginning of the pandemic, the virus has hit us most heavily in certain parts of our community, most notably our minority communities. And we continue to see those impacts in terms of case rates and deaths. For context, I want to share with you just a few slides to give you some information that I think will give us a framework around this. So let me see if I can share my screen here, and I want. Bear with me for just a second. Let me get this right. Hold it back up to here. All right. I'm gonna have something missing here. All right, so this will do. I can make this work. And I want this one. This please. There we go. Sorry. Screen is doing interesting things for me today. So I want to talk a little bit about this framework. What we've seen in providing our efforts to provide vaccinations within the priorities that have been set by the governor and the CDC, and we have made sure in our process that we've tried to honor that prioritization system that you've heard Dr. Gales and the county executive describe. We're in phase 1, vaccinating in phase 1A and 1B for 75-year-olds at this point, and that's where we're vaccinating in county-run sites. To help us with this process, we established a pre-registration system for people who live and work in the county so that they could sign up and be notified of when they can receive a vaccination. To date, we have actually over 230,000 people who've registered registrations in that system. And this first slide just gives you a sense of what we're seeing in that pre-registration system right now. We have 230,000 folks who've registered, and a number of varying in ages from 18 all the way up through 75 and older, primarily female, 58% female and 41% male. But when you look at the race and ethnicity, it's one of the things that you see that is most striking. For context, again, to share with you something else, this is where people are registering, are pre-registering in our system. The gray is where people are overrepresented as a percentage of the population in the census area where they live, and the other colors are those places where they are underrepresented. So what this tells us is that we have people west of the 270 divide who are over-registering. And how is it that you can over-register in terms of the numbers of people, in terms of in relationship to the percentage of population over 75? The short answer is that people are registering several times and maybe repeat registrations, and their children are registering them, they're registering themselves, and maybe friends are registering them. So you get people who are trying to make sure that they are registered for this system. While on the other side, in this other group, you have folks who are, for whatever reason, for a variety of reasons, not registering for this system. To talk about why this is important, you have to look at where we are seeing the spread of coronavirus over the last 3 months. The blue and purple areas in the census tracts indicate where the virus has attacked us most severely in the last 3 months. And those are places where we need to be making sure we are attacking this virus. And then lastly, just a look at the 75 and over population in terms of the population is the black bar at the top, which gives you a sense of how many people by race and ethnicity are in the county. The blue bar is the pre-registrations. So you see where people are over-registered, oversubscribed to the registration system, or have not registered at least in proportion to their population. The red bar is probably the most important one. It represents the degree to which the case rate data tells us that infection has attacked that particular community. So those are the case rates that we're seeing. And what you see is that we are under-registering dramatically in communities that have been most severely impacted by this virus. So those pieces take us to why we need to do this equity plan, to at least one part of why we need to do this equity plan. The plan is intended to vaccinate as many people as we possibly can, and to ensure that the historic and current racial and ethnic disparities in health outcomes are not repeated as we distribute vaccine and go through this pandemic. Our framework is designed to ensure that vaccine is made available to those who've been most severely impacted, and also to make sure that we are attacking the virus where in the county it is attacking us. And you just saw that in the final slide that I showed you. We also have some obligations, some requirement to honor the county's racial equity and social justice laws that were passed over a year ago by county council and with support from the county executive. So our plan is in 2 parts. Part 1 is allocation and distribution of doses. And the prioritization is based on a number of things. First, we will allocate 25% of all of our available doses for the county, for the county health office, is allocated to continue to vaccinate in 1A, and also to meet other requirements that the state has placed on us for vaccinating in independent living facilities or child care providers and so on. The state has a kind of rolling list of things that they want us to do. So the remaining 75% of those doses will be allocated to vaccinate in 1B with 75-year-olds and up. Of those doses that we're prioritizing for 1B, we will prioritize high impact zip codes to receive vaccinations. So what are high impact zip codes? They are identified by the high overall case rates for the past 90 days, death rates for residents not living in nursing homes, but death rates for residents who are in those zip codes, and in some cases, zip codes where a combination of case rates and death rates are high for communities of color. So that may not be captured in the overall rates, but show up as we look more deeply into census tract areas. So there may be some hotspots where infection is higher, but without the zip code actually showing up as the highest. That's a little confusing, so we can talk about that if we need to. Within those top priority zip codes, the county doses will be allocated based on case rate and death rates by race and ethnicity for folks living in those zip codes. So if they've been disproportionately impacted, we want to make sure, and we see that the virus is spreading more intensely in those communities, that we allocate doses to those communities. The idea here is that we will, as I said, we will target the virus where it's hitting us. The remaining doses available will be made available countywide. So it's not cutting out any of the other zip codes. It is just prioritizing our attack and targeting our attack. So that's part 1 in terms of distribution. Before I continue, I wanted to underscore a number of things. One is, as you've heard several times today and repeatedly over the weeks, we are dealing with a very limited supply of doses, which means that this distribution route is processed, and our pre-registration process helps us to strategically target the vaccine and to make sure that there's a fair distribution plan in place. The other piece about this plan is that it only applies to doses that the county public health service receives from the state. Those numbers change from week to week, and so the allocation and how many doses will also change as part of this process. We are, encouraging other vaccination providers and the state to adopt a framework, an equity framework. So far, we've not heard a clear reaction or response to that, but I'm hoping that they are actively considering doing something similar. The other piece is that it's important to note that our registration process is how we work to honor the state's prioritization of 75-year-olds and other groups, and how we're going to stop the spread. If we're not prioritizing and we're not managing this process, then we are kind of randomly taking shots at this virus, and we need to not do that. Let me anticipate a question about this, and the question is, what are the priority zip codes? We are finalizing that list and expect the work to be done on that list by the first of the week. So we'll make it available to the public as soon as it's available. And I want to explain that once that list is out, people should know that those priority zip codes are likely to change over time, depending on where the virus is spreading and how quickly we're able to vaccinate within a particular area. We're going to follow the data and go where it leads us, as we have done throughout this pandemic. So part two of this framework, recognizing that equity is not just a matter of dividing up the doses. We have to find ways to make sure that those doses end up in people's arms. So we are doing a number of things. One is making sure that there is equitable access to pre-registration and scheduling opportunities. Our pre-registration data shows us the disproportionality in numbers of people who are signing up in relation to their population and in relation to the impact of COVID. So we're now trying to make sure that we both honor that pre-registration, but we also make sure that we're not adopting a first come, first serve model that would violate the age priorities and probably limit definitely limit the deny access to people who are in the age group who should be receiving the vaccine at this point. So we want to honor that piece. The other piece of this is that we're aware that our digital system advantages people who have better access and skills technology. And so we have to deliberately reach into the communities to try to make sure that people have that access and are aware of it and have alternative routes through which they can register or be helped to register to get the vaccine. The other variable that we have to address is access to vaccination sites. When the vaccine becomes available, it has to be in a time and a location where people can get to it and can receive it. And we also are aware that we have to address mobility across the age groups, especially for our older populations, older residents. And that certainly requires that we continue to do prioritization, that we identify those challenges and address those as we go forward. And that is still an equity issue, to make sure that groups across the county and all of our communities have access to those doses. And then finally, the plan requires that we address hesitancy and knowledge about the vaccine. We know there is a great deal of hesitancy in the county and especially in our communities of color for a variety of different kinds of reasons, some historic, some more recent. If we're going to contain the spread and kill this virus, we have to understand and address those fears and concerns. And so we've already begun the early stages of our communications campaign that will broadly share both the facts on vaccination, on the vaccination process and availability, and addressing the needs of hesitancy that as part of this equity framework. We started that process near the end of December with a series of town halls in Black and Latino communities, and we've continued that with ongoing town halls and meetings with the county council and the county executive. We have a town hall coming up this Monday with the Latinx community in partnership with the county council. And ongoing town halls with the county council and town executive are planned for the future. We're also reaching out on multimedia with print and media materials to try to make sure that as as we know more about the vaccine and it's available, that the communities are informed. And finally, we are engaging with community partners to make sure that the message about equity, the message about vaccinations, and the invitation to be vaccinated reaches hard to reach communities. Those messages have to be carried by respected and trusted members of the community, not just the folks in media, not just the folks in elected offices, but folks in those communities have to help carry that message. And we're calling them to help us do that. And it has to be delivered in the languages that are spoken in our communities, and not just in English or in Spanish. We have to reach out more broadly. So those are the broad strokes of the plan, and that we think will give us the best opportunity. This is an evolutionary process, and it will be growing and shifting and changing as we know more and have more data, and as we see what happens in response to the increased numbers of vaccine across the county. So I'll stop there.
Thank you, Dr. Crowell. Thank you, gentlemen, for the presentations. And now let's get started with the question and answers portion of this briefing. Rebecca Tan from the Washington Post has questions for all of you, she says. Rebecca, good afternoon.
Hi, good afternoon. Thank you. Mostly for Dr. Crowell and Dr. Gales. My first question is, how long is the current wait list for the pre-registration? So if I'm above 75 and I'm not in a particularly hard-hit zip code, can you tell residents like that how long they should anticipate they have to wait before getting an invitation?
So right now, we don't necessarily have a wait list because as the county executive, and we've mentioned numerous times, we don't know what our next allotment will be. And so it's difficult to forecast out what doses we will receive the following week to be able to map that out. I mean, in a best case scenario, we would see a significant increase in the number of doses that we receive, which would increase our capacity. And so the total size of that number would be larger so we could get more people through the queue. I don't have access to the pre-registration data to say how many folks have registered over 75 who are yet to receive the doses. But from a timeline, it's tricky to forecast that out. I don't know if Dr. Crowell or Dr. Stoddard are able to comment on that piece.
So I can tell you that there are 230, as of yesterday's data, 230,000 plus people who've registered, and I believe we're in the neighborhood of 80,000 to 88,000 registrations for persons over 75, and we have, I think, across the county, from the CE's comments earlier, I believe vaccinated across all of our possible routes, something in the neighborhood of 20,000 people. So if that rate continues, then we might be able to, we can expect it'll be a number of weeks before we can get through the 75 plus numbers and move on to other groups.
Yeah, I'll just give a little more numbers. We're at 20,606 as of data yesterday. 75 and older vaccinated through all sources, including the nursing home contract, the hospitals, Giants, all sources. This is all the data that goes in the state system. 20,606. We had estimated around 73,000, but as Dr. Kroll alluded to, we have more than that pre-registered. We know some of them are duplicates, but we'll have to figure out what the final number is. And last week, just as for context, we did approximately 11,000 through all sources. A reminder again, nursing homes, Giants, all that. So if we were doing 11,000 a week of 75-year-olds, and we estimate we've got about 73,000, we've done 21,000. That's 4 or so more weeks to get through the big chunk of the numbers for 75-year-olds. Obviously, if the doses increases, we will go faster. If they don't increase, we will not go faster. If more doses are put towards places that are not prioritizing 75-year-olds, all those things impact the rate at which we get through that list.
Got it. And two sort of quick follow-ups to that. How is the county ensuring that, or how is the county going to ensure that the people getting the vaccines are from priority zip codes? Is there any kind of verification of where they live?
So yes, as we ask people to pre-register, we ask them to identify where they live and a number of other questions through our pre-registration screen. So at a minimum, when someone comes in, we'll be looking for some verification that they are living in the zip codes that they are county residents, that they live in the county, and that they are from those priority zip codes. But as I said, just a reminder to folks that we've not stopped offering vaccine countywide. This is just a prioritization of a number of the vaccines to make sure we're targeting the virus where it's hitting us hardest. But there will be opportunity for folks, continuing opportunity for folks to register from across the county.
Roger. And one last question. If you can go back to I guess I'm just looking specifically at the slide that showed the rates of pre-registration, the rates of vaccination, as well as sort of demographic data, the one with the black, blue, and red chart bars. Can you tell me again what the white and red bars mean?
Those represent overall rates of infection based on race and ethnicity.
And that's since the start of the pandemic?
Yes, since the start of the pandemic. That's correct. All times, all ages.
Thank you so much. Appreciate it.
Thank you, Rebecca. Next question comes from Stephanie Ramirez, Fox 5 DC, and she has questions, a couple of them. Stephanie?
Good afternoon, everyone. Thank you for having me here. So a few questions more so on indoor dining. As you know, we've been covering this more extensively. County Executive, I'd like to ask you, you had said that the numbers are low because the county has been more protective for a long time. And we also talked with Dr. Stoddard earlier, who had mentioned a 40 to 60% drop in restaurant worker COVID cases since the indoor dining ban went into place. I have more questions with that figure, but what else besides that restaurant drop number has you all pointing toward indoor dining closing as a significant reason for metric drops in the county, when we've also seen now people are getting vaccinated? We are past the holiday travel. Those schools that were doing indoor instruction, they were closed during the holiday season. And also, what information do you have that suggests that there are not county residents going to outside jurisdictions that were open to participate in indoor dining when Montgomery County was closed?
You're on mute, Marc.
Mr. County Executive?
Yeah, I'm trying to find, there it is.
There
Okay.
Okay.
You unpacked a lot of stuff, and I'm going to need to go through this sequentially. Where do I start? We didn't say that dining was the sole factor in lower numbers, but we think collectively we've done a lot of things that were more proactive, more protective over time. And if you look at our charts, you look at the state's charts, that for months we've been toward the lower half of the state, more in line with the smaller counties than with the bigger counties. I think that throughout this, once we managed to get a handle after the first surge, we've been able to keep our numbers a little bit lower. And I think that's because we've been a little bit more protective. As far as dining goes, I'm sure people have gone to other places where they could, but everybody has had limitations even when they were opening. So it's not like it was a free world out there where you could go at full capacity in the area around us. There were limited seating, and I think people didn't go places if they didn't think they could get into a restaurant. I don't suggest it, but I don't control what other people do. They do what they do, and we have no way of knowing, how this all played out for them. But I'm sure it happened. I'm sure it'll continue to happen. But people were going to other counties before COVID, so it's not exactly some new thing that's happened here. What else did you pack in there?
Yeah, with the figure, the 40 to 60% drop in restaurant workers contracting COVID since the ban was put in place. To whoever can answer this, can we see that data? Because I have not seen that data, and we have asked for it. And then also, that number, does that only include the restaurant workers who live and work in Montgomery County?
I think that's a Dr. Stoddard or Dr. Yale's question.
I can answer the question. So we looked at the weeks preceding our implementation of the dining ban, and we were averaging in the state report 48.33 cases per report that were restaurant workers. They are restaurant workers who live in Montgomery County, so they could technically work outside of Montgomery County, but they are people in Montgomery County by residency who identify themselves as restaurant workers. After the indoor dining ban, that dropped to 31 cases. So that was including the most recent report, 37% drop, I believe it is, in total cases on average per week. So yeah, I mean, I don't know that, for example, that, you know, every person who drinks and drives is going to cause an accident, but I know that drinking and driving is dangerous. I know for a fact that dining indoors without a face covering is a dangerous activity. There are studies across the country that have demonstrated that time and time again. There are studies from Europe that demonstrate it. It is a dangerous activity. Now, the numbers have improved to the point where, because of the economic harm that we know restaurant closures is causing, that we've decided that, you know, the county executive has decided, and he's proposed it to the county council, and they'll act on it presumably next week, that the damage caused by the economic harm may be exceeding that of the harm from a public health perspective. That does not in any way remove the risk and the harm caused by the public to public health for doing it, but it certainly is a balancing of interest that has to be done at all levels. And you know, it's a risk tolerance and a risk, you know, sort of aversion question as to when you exactly make these decisions. And that's sort of what we're trying to balance it throughout this event. And Dr. Gale said this very well this morning. This is about harm reduction. You're not going to, in all cases, prevent exposure risk. This is about harm reduction and making sure that we're trying to balance out the harms posed to public health, while also the harms posed by the economic impacts of the public health measures. And so that's sort of where we're at.
Just a few more follow-ups to that then. You know, you have all mentioned, and I listened to the council briefing yesterday where you all said you're not going to go eat indoors, even if indoor dining does resume to 25% capacity. In that same vein, why not then, you know, reopen dining to what the governor has called for, but entrust the members of Montgomery County to do what they feel is safe for their families?
I'll actually take a stab at that. That's ultimately what the policy we're putting forward is doing. We haven't created a policy that mandates that you follow what I do. You know, for example, my job as the public health officer is to provide public health guidance in terms of risk perception and risk mitigation. As Dr. Stoddard mentioned, everything that we're doing right now, short of an entire lockdown of everything we have in society, is a game of risk perception and risk mitigation, because no activity is completely empty. So whether we're talking about being in schools, businesses, gyms, restaurants, any of those, they all carry some level of risk. And our job, and what we have done consistently throughout the pandemic, is provide guidance to our residents to say, hey, if this activity is open, based upon the best evidence that we have, here are the parameters that are put into place to attempt to maximize your safety when doing those particular activities. Hence, we have face covering requirements and physical distancing requirements, and the set of requirements that are being implemented to if restaurants will be open. Here are some steps that individuals can take should they choose to partake in those particular activities. And the last thing I would say is that the approach that we have taken, which has not been universal, is that when other jurisdictions did open up their restaurants, we didn't jump to do so because we didn't have the surveillance data to suggest that we were moving in the right direction in terms of downward trends. It's not meant to say one jurisdiction is right or wrong, but consistent with the approach that we've taken throughout the pandemic. If you think back to the summer when we were talking about phase 0, phase 1, and phase 2 reopenings, we consistently said that before we would move to a next step or change the policy that we had in place, we would like to see a couple of weeks of information and data points to suggest that those improvements in numbers and those downward trends were sustained. Because what we don't want to have happen is to reflexively reopen without seeing sustained trends in improvements in community transmission that will cause a reflex increase in cases that would put us in a position where we have to go back in the very near future and close down those very same activities that we just recently opened up.
So
Thank
Dr.
you, Doctor.
Gale, just one more, I'm sorry, Dr.
Okay.
Gales.
Hurry up, Stephanie, because we have to cut it off
understand.
soon, and we have a bunch of reporters that need to ask questions as well. Very
Dr.
quickly.
Gale, you had mentioned, you're talking about the data and the safety there. Can you just, the science there, can someone please talk about, because County Executive Elrich had mentioned that he got the idea for 1 hour dining limit from a restaurant owner. What is the science to say that that would work? And is there not a concern that limiting to 1 hour, that would actually create more foot traffic because you're pushing people in and out and potentially inviting the virus in even more? And what are you all doing to actually engage all of the restaurant community, since you did get this one idea from this one restaurant?
So there's about 5 questions within that. So I'll try to do this very succinctly. So we continue consistent with the approaches that many of you all have reported on throughout the pandemic of our engagement with the business community in terms of reporting that information, and we will continue to do so. Now, there are no perfect answers within all of this. Again, our job and what we've consistently done is try to adhere to best practices and evidence to mitigate risk and minimize potential risk of exposure in all of the activities that are there. Again, short of closing everything down, everything has some level of risk associated with it. And the thought behind limiting exposure within those settings is to minimize the potential time that individuals are around others and in those spaces, as well as putting in practices requiring people to wear face coverings while they're not actively eating or drinking. And so all of these, again, are efforts put forward to minimize the potential risk of exposure in those settings as those potential activities open up.
Thank you, Corey Smith. Thank you, Stephanie. Corey Smith, NBC4. Corey? All right, Corey, you're not there? Oh, there you are.
Can you hear me? Yeah, can you hear me?
Yes,
Perfect.
yes, we can.
Dr. Starter, Dr. Gales, you talked about a meeting that you had with non-public school educators in terms of getting those folks vaccinated. And it's, it said that the MCPS and it was getting, Hopkins vaccines or vaccinated at Hopkins because they had a list of people ready to go. Once private schools come up with their list, how long do you expect it to take to start getting those folks vaccinated? Or is it, again, an issue of the amount of vaccine you actually have?
So the underlying principle of all of the questions that are related to vaccines have to do with an inadequate supply of doses. So all of the things that we're putting into place in terms of prioritization mechanisms, equity frameworks, access to schools, whether public or non-public, all of those are in place because we have an inadequate supply of doses to cover everyone who is technically eligible for vaccination at this time. And so consistent with that, there will continue to be limits on doses. And so hence schools, as well as a host of other businesses, have been asked to prioritize their staff based upon their level of exposure. And as it relates to schools, the staff who would most likely be in those schools or education opportunities that are most likely to start back once the public schools reopen, and in the instances of the non-public schools for those institutions that have some level of activity that's in-person versus virtual. And so as Dr. Stoddard mentioned, we met with, in addition to having the town hall, to talk through those concerns. And let me first emphasize again, and what we said last week, we have in no shape or form as a county prioritize one group versus another. So let's just clarify that again and emphasize that. And so we met with our non-public leadership. We received their information and connected them with a host of entities, including the Hopkins arm that is providing vaccination. And I was unfortunately not a part of the meeting. I know Dr. Stoddard and Dr. Bridges, our deputy health officer, met with Hopkins to discuss how moving forward, as they've formed a partnership with MCPS, they will be able to allot, I believe, 25% of their doses to non-public school leadership and working with their institutions to get their staff and workers vaccinated.
Okay. In terms of, actually, let me move on to a different question. What is being done? You talked about the plan to really target the distribution in the hardest hit areas, hardest hit zip codes. What is being done right now in those zip codes to get people registered? Folks who might have issues with internet access or just the ability to register on their own. Is there a department? Is there county staff working on the ground in those zip codes to help those folks out right now? Or is that something else you guys are working on?
So we are working right now as part of our overall framework. We launched a communications campaign back in December to try to initially just engage and inform community members. In terms of the pre-registration pieces, we have in the last 2 weeks reached out to members of the community, to the faith community, to our food distribution networks, and in partnership with our minority health initiatives and programs to spread the word that we need people to register and to consider preparing to take the vaccine. And the other thing that we have been doing is, in order to make it easier for folks who don't have access to the technology and who are like myself, a digital tourist in the world of computers, we've created a call-in number that the county executive gave you earlier, so they could call in and we would help them to do that registration process. We've asked our community members to help take on the task of pre-registering folks to make sure that they can have access and can get registered.
Thank you. Next question from Tom Browsey, ABC 7. Tom.
Hey, this question is, I believe for Dr. Gales, you had talked about the 2 preliminarily positive cases of the South African variant. I was wondering if you could go into any more detail. You said you thought they were travel related. Have these people traveled overseas? And then I also just wanted to ask, how confident are you it's not currently spreading community spread? Like, are these folks isolating? Are there people around them who are isolating? If you just go into more details about what's going on with that situation in the county.
So thank you for your question, Tom. I'm not at liberty to answer a lot of what you asked in terms of releasing those details, but what I can say is the necessary public health measures related to quarantining and isolation have been in effect to address those concerns and, as best as we know, to contain potential exposures as it relates to those particular cases. Now, separate from that, I think that we do have to have a larger community conversation over the fact that now we have heard reports of, the UK strain being present in Maryland and Northern Virginia, as well as now new evidence. The cases that we mentioned that are preliminary positive are not the only cases that have been reported in Maryland of the South African variant. And so, the expectation is that there is a good chance that we are potentially going to see some, if not already, some community transmission. Now, in order for the folks at home watching, in order to test whether or not you have a variant strain of it, is you have to take, the sample that you've provided and not just do a regular COVID test. You actually have to do genetic sequencing to test the presence of whether or not it's one of the variant strains. And so it's possible that, some people, get tested for COVID, it tests positive, and there's nothing in their particular history that raises a red flag to warrant that further follow-up. But in some instances, for example, if it's tied to a travel history or we have someone coming from a country that has a high percentage of those variants, something like that could potentially trigger doing a deeper dive and deeper sequencing and other testing to test if it's one of those variant strains.
Are you able to confirm if they traveled internationally? And separately, how much does this whole variant situation concern you with Montgomery County's numbers right now headed in the right direction that could potentially stop that?
Well, not at liberty to discuss, again, more specifics about their case beyond what I've shared, but it is certainly a concern. And so it is, yes, again, on the one hand, we are, optimistic that the numbers are moving in the right direction. But again, we're not saying open everything up and go back to business as usual pre-COVID last year, because the big concern with the variant strains is they're more contagious than the novel strain. And with it being more contagious, it opens up the opportunity that it could be more easily transmitted through our community and thereby increase the number of cases. Now, on top of all of this, so we've got a lot of different things happening. We've got improving case numbers. We've got variant strains now present. We also have more vaccine or some, a slightly increasing number of folks getting vaccinated. So there's all of these different confluences happening at the same time that keep all of us up at night and don't necessarily give us a sense of that, we've cleared this moving forward. And that just underscores why we continue to preach to our residents is that we've still got to adhere to the guidance that we've put out. We're not ready to open up everything full speed. We do have a ways to go in the setting of all of those different influences.
I would just say, I don't think there's any expectation that we're going to be able to contain these variants from spreading. I think it's more a matter of a time and a race between our ability to vaccinate as a country and our ability and the ability of these new variants to spread. We've not been successful in containing COVID that was less transmissible as a country. And so given that fact, I don't think we're going to be any more successful at stopping the spread of COVID as a nation, not as a county, not as a state, as a nation. I don't think we're going to be successful in stopping the spread of these far more transmissible strains. And so it really will legitimately be a race. And, we have to get our numbers in terms of vaccination up across the country between now and March and April. Otherwise, there is real risk that we could be in a much worse situation than we were at that time last year.
Thank you, Tom. Next, Kate Ryan, WTOP.
Thank you very much. I'm hoping you can hear me. Yes?
Yes,
Okay.
we can.
So a quick question. I want to follow up on the variants. Are the two that you're referencing the same two that Governor Hogan tweeted yesterday saying CDC confirmed, state confirmed, this is the South African variant? We're not talking about 4 cases in the county. We're talking about 2, correct?
I'm not sure of the governor's tweet yesterday. I know that we've been in contact with the state surveillance and epidemiology team and are waiting results, and that was as of Monday afternoon. So it is possible, but I do know that there were multiple cases related to the South African variant outside of the 2 that have been reported as Montgomery County residents.
Okay. And then there was a mention that I think it was the health secretary, health officer, I'm sorry, Dr. Chan, saying that variant sequencing is very expensive. It doesn't make sense to test every one of them. Do you have concerns that we're missing variants out there?
Well, the reality is to Dr. Stoddard's point, is it wouldn't necessarily change our management. We're still going to continue to tell folks to get tested, to, wear face coverings. We're not going to go out and open up a ton of activities that could put people at increased risk based upon those exposures. So, she is accurate in terms of, at this point, they are testing folks with a significant history that is concerning for those potential exposures. But it would not change any of the recommendations that we have in place right now in terms of what we're requesting and asking people to continue to do.
Got it. And real quick, because I know we're very short on time, on the zip code situation, I talked to a bunch of teachers who call themselves the vaccine hunters. They are targeting people in their community, particularly Latinos. And they're saying that when they go to White Oak, for example, what they are seeing are folks from other parts of the county who found, aha, there's an opening there. And this may go to Dr. Crowell. Does that mean if we start prioritizing the zip codes, if I am a Bethesda resident, but I lucked out and got a spot in White Oak, will I be bumped? And does this kind of pit the different communities against each other to get those vaccines?
So one of the reasons we set up the prioritization process was to make sure that exactly that didn't happen. As we receive doses, we are sending invitations to people across the county to come in, to schedule appointments and be vaccinated. So as long as you've gotten an invitation, whether that's a phone call or whether that's an email invitation from the county, and schedule an appointment through our process, you're not being bumped and you're not in competition. So we are, as I said earlier, we are going to continue to distribute opportunities to vaccinate across the county. So there's a prioritization in an area, but we will continue to vaccinate across the county. This is the important piece is this only happens if people are registering through other systems. The state had a system up earlier that was creating some challenges for us around prioritization, or if they share the invitation, the link to do an invitation. If those two things don't exist, then there's no competition for folks, and we're vaccinating based on when we have available vaccines.
Okay, got it. And lastly,
can I add one point to this? If it's a competition, we know who is going to win that competition. The people with more digital access, more time to be able to spend on the internet looking for appointments, more family members who are able to navigate the giant Safeway, other opportunities simultaneously, sit on there for 4 or 5 hours and farm out an appointment. And so we will be, if it becomes a competition, we will naturally be selecting for the wealthier, typically whiter portions of our county. And so it's that competition, frankly, that is the thing that we're trying to avoid by ensuring that we're targeting not just, not just from a racial equity standpoint, but from a public health standpoint, targeting the areas where the virus is most spreading, and thus where the vaccinations will have the most degree of protective power to reduce our overall community transmission rates.
Got that. And lastly, because folks in the Latino community are telling me, if you really want to get to me, and you get me on WhatsApp, you use these alternative apps that people are on. Is that something that you're actually using? And has someone come to you to say, that's what you got to do?
Part of our effort is WhatsApp, Instagram, not just the traditional things that we do, like these kind of briefings or press releases, but every vehicle we can get out. And we're relying on the community to help tell us where those apps are and help us to get access to, so that we can message on those apps. So yes, it is absolutely part of our plan.
Great.
So I want to reiterate something that that was said earlier, that of all the people giving vaccines, I read you that list, the county is the only one that's trying to make sure that it goes out in an equitable way. And the state, I've talked to them about this is something that they could fix. They could adopt a scheduling system like ours. They could collect the information that we're collecting, and they could send out invitations based on making sure that whether you're in Baltimore or, the Western Shore or the Eastern Shore or the mountains or Montgomery County, that you're sending out invitations to people that reflect the community and get people scheduled that way. It is a doable thing. I think, we've developed the ability to do that. The state could do that. I know they are revising their portal, and I'm not sure exactly how that's going to wind up, but we had asked them in my discussion with the governor, and they've started working on it, was to deal with the portal, which doesn't allow any prioritization. If you go into that portal right now, as long as you're in any of these groups that are eligible, you can schedule a vaccination. And even though the governor said that, in the case of Montgomery County, we have to finish 1A and 1B, there is no ability of their portal to filter out people who aren't in 1A and 1B. They're all coming in and they're scheduling their vaccines. Even our folks that we send people an invitation to go register, they may have to compete with people who've gotten into the system through the state side for what we're trying to do inside the county. So I think this is fixable, but everybody needs to make a commitment to creating an equitable, not first come, first serve system. And we'd all benefit from this, and it also calm people down. I mean, we have hundreds of thousands of people trying to get vaccinations and competing for 10,000 vaccinations that aren't in the county system.
Right.
It's not fair to tell them they're all eligible and then say, oh, by the way, I can only take 10,000 of you this week. It's created an expectation that's not manageable.
Got it. Thank you.
Gentlemen, if you allow me, let me plug in something. Kate Ryan, you asked about WhatsApp. Montgomery County government does have a Spanish language WhatsApp number. I'm going to give that to you. It's 240-447-1862. And that is a number where Latinos can subscribe and get notifications from us in Montgomery County. And the last question comes from Vicki Warren, Maryland Matters. Vicki?
Yes, this is kind of a segue on what Marc just said and also something Dr. Gale said. So you are prioritizing in Montgomery County because of an inadequate supply of doses. And that's making a difference because the data is showing in the past couple of weeks, the percentage of elderly that are being vaccinated is going up. But now the federal government is going to start giving doses directly to retailers, the same retailers that have the less percent of administration. In terms of the data, they're only administering 33% of what they're getting. And so how is that going to impact your plan? Do you have any more information about whether you'll still get the same doses, what kind of dosage they'll get? What kind of conversations are you having to get ready for that?
These are all big concerns. And I will say, I've actually written folks in our congressional delegation about how the vaccines are being rolled out. If it's the federal government doing this for pharmacies in areas that don't have where they have very small health departments and don't have the ability to do this, That's one problem. But in Montgomery County and probably much of Maryland, and when the call I was on last week with other county executives and health officials and the state health officials, pretty much all of us were asking them not to give any doses to the pharmacies, but to continue to send them to the counties, because we have the capacity to put out whatever you've got. And as long as we've got the capacity, like Montgomery County, we're accountable for making sure we do this in an equitable way. We're not holding anything back. We could schedule everyone. So I would hope the federal government, if they want to do this, they focus those pharmacies in places that don't have, health departments that can do this, but don't give more doses to people around here who are not going to prioritize them either by your age categories or in terms of, race and ethnicity. That's counterproductive to what we're trying to achieve, which is not just getting the vaccines out there, but making sure, as Earl said, that it goes to the people who need them most in the communities that need them most, so that we can tamp this thing down. So one size doesn't fit all, but the pharmacy size doesn't fit us right now, particularly for the trivial number of doses. Take 1 million doses divided by 6,500 pharmacies. I'm yawning.
Yeah, just to follow up on that, Mark, did you hear anything in terms of those conversations or from the governor in terms of having an equitable sort of answer from Maryland? Because some counties in Maryland may want that.
I think a bunch of us would like an equitable approach.
No, I'm saying some counties might want the federal government giving it straight to the pharmacies.
They may, if they don't have the capacity to give it out. But if the federal government does something, they still have the ability to say, these are the priorities and you have to meet. It is not rocket science to collect somebody's demographic data and make sure that the selection you put up every week for who's getting vaccinated reflects that data. I could probably figure out how to write a program that would do that. And I am absolutely elemental in my skills, but it's not that hard to do a sort based on a couple of categories. So I would hope that they require us. I will say this, the state could write the program and give it to everybody. And that would make it really easy. I mean, there is no reason why 24 different counties have to write 24 different programs to achieve what could be done by the state putting its force behind the amazing, IT capacity they have at the universities in this state, and get somebody to write us a program that would work for everyone.
Okay.
If we at the county, we'd be more than happy to have people. We have a pre-registration list with 240,000 names on it already. If any of the partners in Montgomery County are looking for some assistance in making equitable decisions, the county would be more than happy to help you from our pre-registration list,
Yes.
identify an equitable target of people to give vaccine to.
If we knew we had 12,000 doses, we could use that list to portion out to everybody how to do your 12,000 doses and send the right people to the right location. I mean, this is all within our ability if somebody would just let us do this.
Thank you.
Thank you, everybody. I think we've run out of time for today. If you have any follow-up questions, please do contact the Office of Public Information. Thank you, everybody, and we'll see you again next week. Have a great afternoon.
Hey, thank you all.